A great example was in our utilization management area. We had our nurses in UM who were compiling cases and then providing their clinical review on those cases. Right. For some of the cases, they would have to go to upwards of 8 different systems to gather information. So they have to go to one system for demographic information, another system for the med policy information, another system for the actual medical history on the patient, and compile it all together. And it was taking them upwards of 30 minutes to compile a case, right? And then they would go through and do their clinical review and either approve or deny the prior auth as they would need to. But we were able to say, they shouldn't be spending 30 minutes on that, right? We know exactly based on kind of the structured data, the different systems to go to and what to pull in, right? So we were able to, through the touch of a button, basically, using automation, automate that part of their job, right? So now we have freed up from those nurses upwards of 30 minutes per case. That now we can get a lot more productivity in terms of those case reviews. So we talk about kind of the shortage of RNs out there, which is very real on both kind of the payer side and the provider side. Being able to do that has allowed us to get more productivity from those nurses in terms of doing those clinical reviews, because they're not spending their time compiling cases. So that's definitely helped our ability not to have to hire as many nurses. And frankly, it's also up their engagement. Because you know what part of their job they did not like doing? Compiling the cases, right? They're RNs. They want to use their clinical judgment to apply clinical reviews. They don't want to sit there going to 9 different systems or 8 different systems to pull in information.
I don't see why not.
So, we had kind of the added benefit of, not only has it helped kind of in this acute kind of labor shortage, but our staff was a lot happier and a lot more engaged because they were able to more consistently practice at the top of their license.
Right. No, it's all win-win. Actually.
Yeah.
Thank you for visiting the Automation Anywhere YouTube channel. Hit that subscribe button and learn how to build your own digital workforce with our Automation Success Platform. Get your free demo today at automationanywhere.com.